webinar on oxygen cylinder. We need to be aware of how to use oxygen cylinder in our unit. In the present discussion, let us learn how one needs to change cylinder and what precautions have to be taken while using the cylinder in our neonatal intensive care unit. Let us study how to connect oxygen cylinder. Check the cylinder contents gauge on the cylinder valve to ensure that there is sufficient gas content in the cylinder. Be sure the flow regulator knob is set at 0. Make sure the T handle is tight. Open the cylinder valve slowly by turning anti-clockwise until it stops and check for any leak. Ensure that the outlet fir tree connector is free of obstruction. As the valve opens, the gauge on the regulator will show the amount of pressure in the cylinder. A full cylinder will read about 2000 psi, that is pound per square inch. If there is dirt or other obstruction seen, briefly turn the flow dial to maximum to clear it. Ensure that the correct equipment is selected for connection to the cylinder. What are the essentials of cylinder for oxygen delivery? Pressure regulator and flow meter are essential connections for using oxygen cylinder in the neonatal ICU. They ensure appropriate and precise delivery of oxygen to the neonate. How do we check the leak in the cylinder? Leak in the cylinder is suspected if there is hissing sound heard when the flow meter is started. In this case, close the valve, remove the connection, check and refeed the connector to the cylinder. How does one store the cylinder? Oxygen is a non-flammable gas, but strongly supports combustion. Do not store or use cylinders near naked flames, source of ignition or combustible materials. Ensure that the oxygen cylinders are stored in a safe and secure area where they cannot fall over and cause injury. Smoking should not be permitted in the vicinity. Ensure separation of full and empty cylinders. So, what are the carry home messages? We need to be conversant with regards to changing and connecting oxygen cylinders in the NICU. Flow meter and pressure regulators are essential for oxygen cylinder in neonatal ICU. One needs to be careful in terms of safety and care of use of oxygen cylinders in the neonatal ICU. Thank you.